Schools are scrambling to draw up reopening plans as many prepare to welcome back students in a matter of weeks, despite several states seeing surges in COVID-19 cases. Joining us now is Lily Eskelsen García. She is the president of the largest teachers union in the country, the National Education Association. Thank you so much for joining us.
It's an honor to be here. Thank you for having me.
So I want to talk about the different plans on reopening, but first let me get your take about President Trump and the Education Secretary, Betsy DeVos, their insistence that students return to school this upcoming year. What do schools need and teachers need to hear from the federal government? What do they need to see from the federal government to feel as if they are able to reopen safely?
So let's unpack that very good question. I'm a sixth grade teacher. I've had 39 kids one year in the same classroom with one window. I represent over 3 million teachers, support staff, the school secretaries, the bus drivers. Any one of us is more qualified than Donald Trump and Betsy DeVos to talk about what we need to open schools safely. We are outraged, mystified. All of a sudden, we're getting orders and threats from the Oval Office that has absolutely no authority to give orders to a school teacher or staff to do anything. They have no power to threaten our funding. Federal funding is what helps special education and school lunch, that they'll threaten our students if we don't obey them. And so my advice to all of my panicked colleagues out there who immediately lit up my email and my phone, like, what are we going to do? They're just telling us to step our kids back into a classroom. They're giving us nothing to keep us safe, not even a bottle of disinfectant. And I said what I'm saying now: ignore Donald Trump and Betsy DeVos. Listening to them is not good for children or other living things. So we're going to do what we have to do, and we will ignore these people who are threatening our students and thinking that they're the boss of us, and they're not. We're going to do what's right, and it's not a one-size-fits-all. It's not going to be stuffing my 39 sixth graders back into an unsafe classroom. I knew every year that someone was going to sneeze on me and some little kid was going to touch their nose and touch stuff, and I was going to catch somebody's cold 3 times a year. I signed up for that. This is different. Someone coughs and someone could die. This is different. And that politicians don't get that is just too astounding to talk about. What we need to do, we are getting the best guidance from medical professionals. I'm a really good sixth grade teacher. I am not an infectious disease expert, and neither is Donald Trump or Betsy DeVos. The difference is I'm going to listen to what they're telling us to do. Ironically, Donald Trump did throw out some countries and said, look, Denmark, Germany, Australia, they opened their schools and everything was just fine. They did this in a very different way. They did this very intentionally, very carefully. And number one, there was a national response to getting the infections under control. There was testing, there was tracing, there was treatment that was from the national level. We have done none of that. They made their teachers and support staff essential emergency workers so that they got in line right there with the hospital workers for testing, tracing, and treatment. They gave them the PPE, the personal protective gear. They gave them the disinfectants. It didn't come from the school budgets. It came from their federal governments. And they carefully made sure they had equity as the center. They understood that some kids had very little in their homes to keep them safe or to have the technology to learn virtually. And so they made sure that all kids were able to have the same opportunities. That's what we need to do. Donald Trump did none of the above. And what we're really going to do is listen to the medical experts, look at where they did it well, and you're going to have to develop and design something very different in a rural area than in an urban area. trust us to do what we need to do to keep our kids safe.
So, Lily, the reality of it is that, we didn't do things the way they did in Australia or other countries that waited for the numbers to come down. Our numbers are going up as we're winding the summer down. So this is what we're dealing with now. And we also sort of, there's an absence of clear directives from the federal government. And so what we're finding is that districts and, counties, municipalities, they're all kind of creating their own path forward. And they all have different issues to deal with, whether it's spiking cases or not spiking cases in their area, or, just basic logistics. Is Wi-Fi available and all that sort of stuff. So there's this patchwork thing happening. I know here in Philadelphia, the public school system, they've been doing a lot of virtual town hall meetings, but the parents that I've been talking to feel like there's a lot of talk, but no actual plan being presented to them. No explanation as to how you're going to keep children 6 feet apart when there's 40 kids in the classroom and no one's rebuilding the size of these classrooms. That is, it's finite. That's not going to change. We're seeing in California, at least the Orange County schools, they're saying they're going to have in-person instruction, no mandatory masks required. They're not going to even bother with social distancing. I'm wondering, with what we're dealing with here, not what Australia is dealing with, but what we're dealing with here, have you seen a school board or a governor that's doing it right?
Where people are doing it right really is on the local school district level. And there's I've been asking all of my colleagues, send me your examples of where there's actual inclusion of that teacher's voice, that the school custodian is being included in. How are we going to disinfect these places? And some of the smaller communities are the ones that really are being very inclusive. They're listening to the health professionals. They've got the folks that are at the local hospital who are worried about doing it wrong is going to mean a surge there. But where they're doing it right, they're starting with the basics. They're saying we do need to distance those kids. And yeah, you can't do that with my 39 kids. But they're saying we care about their social, emotional, and mental health. They're kind of going a little crazy in their homes right now, and they don't feel safe. So they're saying, let's come in for 3 hours in the morning. We'll put the kids in shifts. It means running the school buses an extra shift. So that's going to be costly. Some are saying the older kids are...
Sorry, Lily, let me just jump in real quick. Sorry, just to so we can cover as much ground as possible. Teachers and parents have been raising concerns, as you know, about returning. And I just want to play for our viewers what some of them told our CBS affiliate.
I've been to a funeral for my student. I do not want to go to another funeral. I do not want that pain put on our families. I don't want that pain put on our school districts.
Personally, I think a hybrid approach is probably the best course of action. I wouldn't want to see full distant learning. I mean, it would be very difficult for us to manage that.
I have over 200 kids on my roster twice a week. That means I have 400 contacts per week. I'm not okay with that.
This sort of, Lily, rolls into what, Anne-Marie was talking about. I mean, you hear from these teachers, you're hearing from parents, and yet I guess a lot of people are wondering, well, okay, it's hard for us to look at what's going on outside of the United States because, as you say, their situation with regards to the pandemic is very different than ours. So what are the biggest concerns that you've heard from the parents and teachers who want to see this addressed before the start of the school year? And I know that, for example, I saw this morning a piece that one of our correspondents did on a school in New Jersey that, took us on a tour of the school, and they showed us how they're going to space students apart, and they showed us how teachers are going to be able to interact with the students in a way that they believe is safe. So that might be one school that is perhaps thinking about doing it properly, but not every school has those capabilities. Not every school has that level of money. And so it's just hard for people to wrap their heads around this because it is left up to the local municipalities to figure out what is best for them.
And so I think the biggest part of the piece of the puzzle is that you're inclusive of everyone that has a stake in making sure it's done well. Where it's not being done well, it's some politician. It's the governor's office. It's some business roundtable saying, oh, this is easy, just open the schools. That is a recipe for disaster. Where it's being done well, they've included that kindergarten teacher, the school nurse, the custodian, the special ed parent, the parent that says, I have a medically fragile child. What's going to happen can look very, very different. And it is a combination of distancing, disinfecting, the PPE equipment that you need. That's the mask, the gloves, all of that stuff. And also the daily health checks. Think about what they are asking restaurants that opened up to do. You can open up at 50% capacity. You can open up, but your cooks and your waiters have to wear masks. Why would it be any less for a school? We can be creative to a certain point, but at another point, it is going to be costly to have Donald Trump say, hey, this costs a lot of money. We're not doing that. We'll have them rewrite the regs so it doesn't cost any money. No business could have done this without it costing money. Why should a school? I've got teachers who have started a GoFundMe page and asked for masks and disinfectants because they are so sure that no one is going to give them what they need. Where it's going to be done well, people have to see that the resources have to be there. Let me just throw in, Mitch McConnell right now on his desk, there is a bill called the HEROES Act, passed by the House. It would send billions of dollars, $200 billion to school districts like that to purchase the things we need to open schools safely. It is not going to rain from the sky. We need that money, or it is going to be virtually impossible for many of our school districts to even think of opening safely. Why don't they want us to do this right? Why was it so easy to understand Shake Shack needed some help, but not your local elementary school? Makes no sense to me. We're still trying to figure it out. We want to do it right. We're going to need some help. And why aren't more politicians helping us?
You know, a lot of questions, and it's so hard, I think, to know what the future is going to look like. And of course, we barely scratched the surface of the issues, and Anne-Marie and I have talked about them, the issues that can come about for kids who are not able to go back to school. Certainly that is a big concern for a lot of parents. A lot of parents feel that their kids need to get back to school. A lot of educators have said that the longer kids are out of school, the more detrimental it is to their growth. On the flip side of that, of course, are the health risks, not only to the kids, but to the teachers and to their families back home. Lily Eskelsen García, thank you so much for spending some time with us. This was really interesting. We appreciate it.
Thank you. Thank you.